Have you had diabetes before? Hypertension? Any of these? If you've had any of these before, kindly spare me a brief time. Let me show you this. So anyone who has diabetes, bear in mind that it's going to weaken your blood vessels. It doesn't matter whether it's a small blood vessel or it's a bigger one. When it weakens it, it also weakens the muscles. So at any point in time, there can be a rupture. It can tear off and then there's a wound, isn't it? Now, in this wound, if there is any injury on the body, your body wants to try put or form some clots around the area. Now, this clot formation ends up forming in your blood vessel. So in the blood vessel, there is a clot. Now, in this blood vessel, there's also blood flowing through it. The blood flowing through it can rupture the lower part of the blood vessel, which means that there's going to be dislodgement of this clot, the same clot. Now, this clot can move into your lungs at one point in time, and then it's called something we call pulmonary embolism. It can be in your feet, that is especially your gastrocnemius muscle around that area, and then you get a DVT. We call it deep vein thrombosis. This same thing can travel all the way to your brain and cause a stroke. If it ends up in your heart, it's called the heart attack. You know these names. If it ends up in your stomach, we call it ischemic mesenteric or mesenteric ischemia. All right, now enough of all these medical terms. Let me walk you through this. When all this happens, is as a result of what we call atherosclerosis. I'm excited to bring you the same thing, atherosclerosis. So atherosclerosis is having the intima layer or the inner part of the blood vessel being formed with a lot of low density lipid. Okay, when I say low density lipid, a lot of us have heard about LDL, HDL. So that is a cholesterol formation that lines in the layer of your blood vessel. How does this form? You are consuming a lot of diets that contains bad oil. You are also your body is also breaking down a lot of cholesterol or fat tissues through your exercise, or if you don't exercise. If you're someone with a family history of this bad cholesterol, you're at risk of getting it. If you're someone who doesn't exercise, you live a sedentary lifestyle, your age, the food you are eating is filled with all these things. Bear in mind, it has a way of blocking all these areas in your body. As a matter of fact, if you want to prevent these things, you have to be very regular with your doctors so that they can have a lipid profile check for you. You can check your blood levels. If there is any form of infection in your system, it can be checked. If you can tell that you are gaining a lot of weight, you are becoming obese, you need to seek for medical attention. It's not just about the obesity and losing weight. It's all about the atherosclerosis plaque we want to prevent. When we try to correct all these things, we most often use the DASH therapy. And the DASH therapy, I'll be coming back to you to help you answer this problem. The DASH therapy is actually approved by WHO, and that's what we are going to do. Otherwise, you need to help or get yourself sorted by your doctors, and they can help you. They will request for all the labs that you need, and then after which, if there's anything that can be done, we can help you. But before you leave, make sure you take greens, fruits as your best friend. Reduce the amount of oil or the type of oil you are using. We prefer you to use the olive oils. If you use that, it's better. Those who know of the coconut oil, they are using it. Eat a lot of fruits and vegetables. If you need any form of such or examples of those, put it down in the comment section and I'm going to sort you out. Holla. Okay.